Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MDTV. Welcome to Super Mama Sunday, and you definitely want to stay tuned because today I'm kicking off our series on preterm birth. November is Prematurity Awareness Month, and even though this video is going to air in December, I'm recording it in November, and I'm going to be recording this entire series in November, but y'all will see it in December. But anyway, we're going to be talking about preterm birth because it is such an important topic, especially for Black women and babies. So I want to make sure that you get all of the important details that I'm going to be sharing over the course of the next few videos. So make sure you're subscribed, then you don't miss a single Super Mama Sunday episode, because I'm going to be giving you all the tea about prematurity and preterm birth. Make sure you keep watching. All right, Super Mamas. First of all, we need to put some gloss on these lips because they're looking real crazy right now. All right, now that I'm moisturized, I think I can go on and talk about preterm birth. Preterm birth is a very serious thing, and we know in the United States that it is certainly something that's happening much more frequently than it needs to be. And the March of Dimes is probably the premier organization that deals with preterm birth and researches preterm birth and helps families who are living with prematurity. And so a lot of the statistics that I'm going to share with you come from the March of Dimes website, and I'm a very proud volunteer for the March of Dimes, so shout out to the March of Dimes. But I want to jump into some of the statistics. You can look up the statistics for your particular state, but I'm from Georgia, so I'm going to be talking particularly about the things that are happening here in my state. So let's jump into this. So you can go to the March of Dimes website at marchofdimes.org and look up the statistics for where you live. I live in Georgia, where we're not doing so hot for our score. The March of Dimes gives all states a grade, but I'm going to try to keep things broad so that the statistics I'm sharing apply to everybody. So let's jump into these statistics. So preterm birth is basically defined as birth that occurs before 37 weeks of pregnancy, and that's about 10% of all births in the U.S., which is a pretty high number. That means that 10% of babies who are born in the U.S. are being born before their due date. So about 20% of the babies that are born preterm are actually born by planned preterm birth. This is usually because there's some kind of a medical condition that a mom needs to be delivered prior to her due date. So this might be things like uncontrolled diabetes or high blood pressure, or some kind of condition with the placenta, or just any number of things that could be going on that make it more high risk for a mom to stay pregnant than to deliver prior to 37 weeks. So that would be a planned preterm birth. Now, let's define the difference between preterm birth and preterm labor, because everyone who goes into preterm labor may not have a preterm birth, right? Get it? So if you go into preterm labor, meaning you're having contractions and your cervix is actually dilating, we may be able to stop your labor. And 30 to 50% of folks who go into preterm labor are actually going to be able to stick it out until term, till at least 37 weeks of pregnancy. And 37 weeks is considered early term. So if you make it to 37 weeks, even though you had preterm labor, then you're still considered to have a term birth. Whereas preterm birth means that not only did you go into preterm labor, but you also delivered your baby before 37 weeks. So preterm labor is serious, but preterm birth is even more serious, because then you have a baby who was born prior to 37 weeks who is then suffering from prematurity. And people often have this thing where they're like, oh, I had a preemie and the preemies are so cute. Prematurity, y'all, is a disease. Premature babies suffer. So we want to be clear about that. It's not just okay to be having babies prematurely. So I often have this conversation with my mamas who are just like, oh, I'm so tired of being pregnant, or I don't feel good, or I'm uncomfortable. Can you just go ahead and put me in labor and let me have my baby at 32 weeks? Absolutely not, because as long as you are healthy you want to try to get your baby to 39 weeks or more, because we know at that point that your baby's lungs are fully developed, that your baby's intestines are fully developed, that your baby's brain is fully developed, and that is the least likely chance. 39 weeks plus is the least likely chance of your baby having to be put in the neonatal ICU or NICU. So we really want to try to get to late term. 37 to 39 weeks is considered early term. And so we want that 39 plus weeks if we can get there safely for both you and for your baby. Now, if the risks for you staying pregnant are outweighing the benefits of you staying pregnant, then that's a different discussion. But if you can get to 39 weeks or above safely, that's where you want to go. So over the course of the next few videos, I'm going to be talking to y'all about preterm labor, what some of the risk factors of preterm labor are, what some of the causes, some of the things that we know can cause preterm labor. I'm going to talk to you about how to identify preterm labor and how we actually work that up in the hospital, so you kind of have an idea about what's being done when you go in to be assessed for preterm labor. And then I'm going to also do a video on some of the things we're doing to help predict preterm labor. So I'm going to have some special guests, and I want you to make sure that you're tuning in to get all of these important details. I also want to talk about the disparity that happens in preterm labor. We see that Black women are much more likely, twice as likely, to have preterm labor and preterm birth than other women. We're going to get into that during this series. And of course, we're going to have a whole opportunity to discuss signs and symptoms of preterm labor, because sometimes those can be a little bit sneaky and people may not even recognize that they are at risk for having a baby preterm. So make sure that you are subscribed, that you are tuned in, because we're going to be talking about this, having some really good dialogue, and I don't want you to miss it. We're going to be hitting all of these important topics during this series. And if you've had a preterm birth, or you're pregnant now and worried about preterm birth, if you've got questions about preterm birth, make sure you put them down in the comment section so I can make sure I address your specific question. Make sure you subscribe so that you don't miss any of this important information. And I will catch you next Sunday, Super Mamas. Peace.